is my pleasure to introduce Dean Welch from Western New England University, who's going to talk to us today about some of the trends and what's going on in the world of pharmacy today. So thank you for being with us today, Dean Welch. This is recorded and then put in the library after. So please go ahead and get started.
Okay. Thank you, Dr. Madison. And for those of you that do not know me, as Melissa said, my name is Beth Welch. My role here at Western New England is I am the Senior Associate Dean for Academic Programs. I've been here since 2009. Prior to this, I was at MCP in Boston, and I've spent pretty much over 25 years in academic pharmacy. So I'm happy to spend a little bit of time here with you today. I was hoping to generate some discussion. I'm hoping that I can do so because I want to share with you some projections in pharmacy workforce. And I think this is a great opportunity for us to all put our heads together and think about, what we can do and what we are able to do to support the pharmacy workforce going forward. So I'm going to share my screen. Great. And I believe you should be able to see my screen now. And as mentioned, I'm going to discuss a little bit about pharmacy workforce projections. Certainly projections are not always accurate. But the data I've gotten is from the Bureau of Labor Statistics, as well as some state agencies that predict what's going forward in pharmacy workforce. So let me start by going down, page down. All right, so BLS, or Bureau of Labor Statistics, is predicting a 5% growth for the next decade from 2024 to 2034. And as you can see over here on the right, 5% growth is an increased growth over all occupations. So it is showing growth. It's a little bit less than some of the other areas of healthcare practice, which some of them are predicting 8% growth over the next 10 years. And that's typically highlighted by growth in areas such as nurse practitioners and physician assistants. So a lot of growth in that area. Massachusetts, actually looking at their data from their state websites, is predicting an 8% growth in the pharmacy workforce from 2023 to 2033. What this means is they're projecting about 14,200 openings each year over the next 10 years from 2024 to 2034. I want you to keep that number in mind because in the next slides, I'm going to compare it to something. The openings are generally predicted to be due to the normal loss of members in the workforce, either through just retirement or changing out of the profession. The demand is expected to increase more in hospitals and clinics. And this is because of, I think, predominantly the extended job responsibilities for pharmacy. As you might be aware, many states now are opening practices for pharmacy to help that primary care shortage and doing things like collaborative drug practice agreements and having more clinics for pharmacists. They are suggesting that community pharmacy, the workforce in those areas, might decrease, and this is due to potential increase in mail order or online purchasing of prescriptions. So again, this data is predictive for the next 10 years up to 33 or 34. And I've listed the references here on this slide. Anybody can go to this as public information. It's kind of nice information to be able to screen through. So what I want to do is I want you to think about this projected job growth in pharmacy and the number of openings that are predicted each year. Keep that 14,200 number in mind, because on the next slide, I'm going to compare that to how many pharmacists are actually entering the workforce through graduating from colleges of pharmacy. So this data is obtained through the American Association of Colleges of Pharmacy through their institutional research. I did pull the latest data. They only had through 2023 degrees conferred. But I've also shown you what enrollment is, so what the projected graduates are. So on the left side of the screen, you can see here from 2015 down to 2021, we probably could have hit that 14,200 new openings each year. But the number of graduates and degrees conferred going forward from 2022 to what's projected to 2027 is significantly below that. You can see here in 2022, the number of degrees conferred was 13,323, and it's decreased year by year. So enrollment in colleges of pharmacies has shown significant decreases. On the right side of the screen, you'll see enrollment. And again, this is projected. This does not include attrition. So for the class of 2027, that's the current enrollment, 9,000 students in all colleges of pharmacy across the US. And some of them may not actually graduate. And we also have to keep in mind, not all graduates actually enter practice. So to me, this is kind of alarming if you're thinking about, the class of 2027 graduating 9,000 students, but the predicted openings is 14,200. That's a little bit kind of, oh no, what are we going to do? And I don't want to say the sky is falling, but I think it's something that we need to keep in mind. So as I mentioned, over the next 4 years, we're looking at roughly 9 to 10,000 or 10,000 students graduating from colleges of pharmacy, but that won't fulfill the projected openings. Certainly people can enter the pharmacy workforce from not just graduating. It might be people that maybe took some time off from pharmacy and will re-enter. But what they're saying is there is a shortage that is expected. So I really would like to open the conversation here as far as, what are our thoughts about this shortage? Do we think it's a real shortage? Is it a fake shortage? Are these projections wrong? And also, what we can do. So if indeed there is going to be a shortage of pharmacists, what can we do as in academic pharmacy as well as in, practicing pharmacy to help stave off this shortage. So I'm gonna stop my share here, and I'd like to hear from anybody here in our audience as far as your thoughts on these numbers. Do you feel that there is any truth to them? And if you don't, why? And if you do believe there's some truth, what are your thoughts as far as what the shortage may what it may do to pharmacy?
Dean Welch, I have a question that maybe folks who have been in academia for a bit longer than me can answer. If I recall, we have had pharmacy shortages in the past, right? So what were the trends back then? And what did we do about it at that time? I'm wondering.
Well, I can remember when I graduated from pharmacy school in year they were giving sign-on bonuses in certain states of brand new cars. If you wanted to go to Maine and a new Walmart was opening up, you could get a brand new car along with a job in a pharmacy. So I've seen that as being, the carrot to get people into positions. But I'd like to hear from other people as well, what your observations have been.
When I graduated, there was the same need. And I was a new mom at that time, and I worked for a temp agency. So I don't think they have those anymore. I'm not sure, but So wherever there was a need, if they couldn't fill it, the community pharmacy would reach out to the temp agency and I would fill in at different pharmacies. So not the best job going community pharmacy, different chain to different chain, but it was an option.
Mm.
I think one of the things too that has happened, I would say about 7, 8 years ago, there was the view that there were too many graduating pharmacists. With the growth of the number of pharmacy schools, they thought that the market was saturated. That did happen for a little bit of time. It was a little bit more difficult for our students to get positions. But I think the overreaction in the other way has occurred with, pharmacy schools really under enrolling. And some of this is due to perhaps, you know, workplace conditions. There's been a lot of talk about working conditions in some of the pharmacies, particularly in community pharmacy. I think we had a huge COVID hit and it really overextended pharmacy, and not only pharmacy, nursing has experienced a very similar situation in that, nurses were leaving the workforce in droves from COVID. And certainly pharmacists had to pick up a lot of, with the immunizations and the vaccines and stuff, they were really overworked. And I'm not sure if, and perhaps somebody here in our audience can speak to that, if the working conditions have changed, but, there's been a lot of negative articles about pharmacy because of the workplace conditions. And, maybe that has further, lessened young people's desires to enter pharmacy.
I know over the years we've talked about how do we promote what we do to almost like as a public service message. And our national representative bodies have tried to do this or talked about this. We've talked about it locally, regionally also. But we probably can do a better job about highlighting what a pharmacist does today. And I do agree some of the working conditions, those sometimes misconceptions and sometimes accurate descriptions are out there and they are damaging, I think, to people who might want to go into pharmacy or they're encouraged to go in another path in healthcare. People don't know how many exciting roles there are. And so I think it's a public service imaging problem too that we might have.
Yeah, I think they had to put a pharmacist on Pitt, the show, to get that out there, as far as glorious pharmacy is, that would probably do us that would do us a lot of good. I think maybe Melissa, you want to try out for that role.
That would
But
be very
yeah,
funny.
getting the image out there, we've tried in some ways. I think, AACP has, pharmacy for me, but I don't know really how, widespread those things are for young people to spark interest in pharmacy.
Yeah. There's like, I know when I was in community pharmacy, I had a shadowing experience. So we had a high schooler shadow in our pharmacy. And some of those programs seem to have gone away. And maybe because of COVID, there's not as many opportunities like that. But this student actually went to pharmacy school, did a residency, and has a great job now. And just seeing that progression, like maybe talking about it earlier, seeing what it's really like would be helpful.
We've done some of that here at Western New England with our summer camp, and we're bringing in a lot of the middle school students to take tours. So I think that's good, but certainly on a national level, probably could do more.
Yeah.
Emphasizing that.
It'll be interesting to see if we are 5,000 pharmacists short, because that's really not going to be good. I'm from the days where we would call people to come work. We'd pay them double time. We'd pay travel time to cover a shift. And we'd spend hours calling people all across the state of Connecticut, all across Western Mass to cover shifts. And I know it's still pretty short, actually. And the backroom deals you have to make to get a shift covered is significant.
And I think we think about the impact on, us as pharmacists, but what is the impact going to be on patient care? That's ultimately where this shortage could have some significant effects is directly on patient care.
With the number of pharmacies they have closed, what percentage of those jobs will be filled with current pharmacists who have lost their jobs due to closures? Do you know?
I'm not sure. That's a good point because there have been more community pharmacies closing. You're hearing about it quite often, particularly in urban areas. So that where will that shift? Where will they make up some of that shortage that's predicted?
Yeah.
So one of the things, so I think, giving publicly kind of spreading the word about the pharmacy career might increase our enrollment at the colleges of pharmacy. One of the things that I think we've done at Western New England is we've opened our enrollment pool to a group of potential pharmacists that would have never considered entering pharmacy. And that's through our distance learning pathway. Most of these individuals are older. This might be a second career for them. And so it has opened the pools to a pool of potential pharmacists that never would have considered going to pharmacy because most, adult people cannot, quit their jobs, move across the country, live on campus while taking care of their children and their parents. So I do feel that we have done something that is giving some really high quality future pharmacists the opportunity to enter the workforce. We're not the only program. A number of other programs are opening online programs. But I'm very what's the word I'm trying to think? Pleased with our pool of applicants. They represent typically a very mature, responsible group of individuals entering the workforce. So I am happy to say that we're giving them that opportunity.
Yeah.
I think one of the things too for any of our pharmacists here, just even locally, speaking to if you know any people that are interested in pharmacy, trying to spread the word, it's not all, butterflies and roses, in the profession, but overall, I think, it's a good job. And the outlook for it is looking very promising. Maybe there will be some of those sign-on bonuses coming forward. But the opportunities for pharmacists is increasing as well. And I know, Courtney, you're here from, you're a leader at MPHA, but I know Massachusetts itself is really struggling and trying to, open opportunities for pharmacists in a more provider-like way. Maybe you could speak to that for a moment.
I think it comes down to reimbursement as far as provider status. Technically we have it. Technically, like we can prescribe birth control, things like that. But if we're not getting reimbursed for any of those things, it's not a great business model, right? We already have a business model where we give away our services for free. But the more we do it, the harder that job becomes. So working with private companies, insurances is not that easy. But they're working on it. And I don't know how this recent, so the governor signed a change for the vaccines. So I'm not sure within this New England, Massachusetts region whether is like an appreciation of pharmacy and what they offer. So hopefully that continues and is recognized because we've never gotten so many reporter calls as in the past month. Every day there's some paper, TV that wants to discuss pharmacies.
No, that's good. I think that's it's it's a positive. So that is good. I think one of the things we also have to think about, is we're only one pandemic away. There's been, the worries of other pandemics coming down the road, and if we're already at a shortage, what will that do? Again, I don't want to paint this dismal picture or anything, but I think we need to be prepared for, the potential things that could be coming down. And a lot of us feared, the entry of robotics and technology into prescribing. A lot of people were very resistant. Oh, we don't want these things taking over our jobs, but we may need to, these are perhaps positives for us. I know with community pharmacy, a lot of the central fill and things like that is kind of taking over some of the manual dispensing piece for pharmacists. So. Well, Melissa, you told me to keep it short and sweet, so I did.
I appreciate that very much. No, that's a good discussion. It's really great to see those. No, it's not really great to see those numbers. It's really enlightening to have this information and be aware of possible trends that are happening and how we could possibly combat or help some of those maybe emergent situations. So thank you for your time putting this together. I really appreciate it. Maybe we can revisit in a year and see what we think has changed or happened since then.
Yeah, I really would, I think it would be really interesting because as I mentioned, the projections are not always accurate. I mean, again, it could just be one pandemic that changes this whole, these whole numbers, or it could be a major movie with a pharmacist star that, all of a sudden enrollment goes through the roof, so, things can change, but it's something that I think we really need to be mindful of, because it will affect us, both in practicing pharmacy and, academia has seen its effects in the past, 4 or 5 years. A couple of pharmacy programs have closed even recently. So, we're seeing it on both ends in practice and in academia. And, if we can all work together to promote the profession and get some legs under it, I think it'd be very helpful.
Yeah. Thank you. Thanks everybody for coming. This will get archived and be put in the library. So we'll look forward to seeing you all next time. Actually, we have our CE in October, which is going to be in a Zoom format. So everybody across the country can come. And those announcements have gone out and saved the dates. It's Tuesday, October 28th. If I'm pretty sure I've got that date right. And then we will have a wellness one and a mental health one, especially with a focus on students on rotation by Dr. Janet Kennedy, and that will be in November. So thank you all for coming, and we hope to see you soon.